Health Minister Andrea Leadsom with us now. This dovetails nicely into what you want to talk about today.
It really does. Yes, it's amazing. What we're launching today is more support for families to understand how to respond to their baby's directions. And people would say, well, how does a baby talk to you? But the reality is the campaign we're launching today is the response to a lot of research with parents and carers who are saying to us, when my baby's crying, I don't know why they're crying, what's going on there, or when my baby's sort of gazing at me or whatever. So the campaign we're launching today is called If They Could Tell You. And it's things like a picture of a baby in his father's arms, and if they could tell you, he would be saying, I love it when you cuddle me, daddy, for example. Or it might be if your baby's crying and there's a picture of a baby crying and it says, actually, I'm bored. Because there are certain assumptions that we all make as parents as to what a baby means. But the reality is that it often doesn't mean what you think it does. And parents have said, we would really like to understand more about that. And the reason why this is so important is because it's in that period from pregnancy to the age of 2, what we call the 1001 critical days, which is where the foundations for not just physical but also emotional good health are laid down. So actually understanding and meeting the needs of babies is really important.
Isn't that what you learn from friends and family, potentially your mum, and you don't really need the government to help you with that?
Well, absolutely. And for lots of families, that is the case. You know, a friend, a sister, a parent, etc. But also for lots of families, what the research over several years now, I mean, I've been involved with, my passion has been babies and giving every baby the best start for life for 27 years. And what the research shows is that families really do need a bit of extra help to give their babies the best start for life. So we're rolling out across England a Family Hub and Start for Life programme to create a one-stop shop. So if you're expecting a baby, you can go to that Family Hub, you can get your antenatal checks, your health visiting baby weigh-ins, you can get parenting classes and stay and play. So you can make friends, meet people, get the support and advice that you need.
You mentioned the Princess of Wales there. Thoughts on suggestions that continue in the papers this morning that her personal records, 3 members of staff attempted to access those at the London clinic?
I mean, it is completely outrageous. Obviously, it's a matter for the Information Commissioner, but it is the case that every patient has the right to their privacy.
OK, talk to me about, given your title, talk to me about what's going on with the doctors. I mean, it looks as though the junior doctors, well, definitely the junior doctors have decided they want to continue to strike.
Yeah, and that's so disappointing. Junior doctors have had a 10% pay rise, in fact, more than a 10% pay rise. And the government was in discussions with them when they walked away from those discussions last time in order to strike. So, you know, I just really do hope that junior doctors will come back to the table and will discuss with the government again. There's more that the government would like to do to support them over conditions of work and so on and meeting their aspirations, but it's very difficult when they just continue to strike. And of course, the point about that is adding to the burden on NHS waiting lists, and patients are suffering as a result.
Yeah, absolutely so. And as the government, you have a responsibility to try to get these doctors around the table again. What has happened that it's continued on for so long and there looks as to be no end in sight? Meantime, waiting lists continue to grow as a result and people having their appointments cancelled at the last minute.
Well, as I've just said, we've tried and we continue to try to get the junior doctors back round the table, and we wish that they would come back and talk to government again, negotiate with government again, rather than going on strike. And at the end of the day, the people who are suffering as a result of this is patient care, and NHS waiting lists are a real problem. During the 1 month without strikes last November, we managed to reduce NHS waiting lists by 95,000 independent appointments and procedures. So it shows that we can reduce the waiting list very swiftly if we can have a period without strikes. So I do urge the junior doctors to get back round the table.
Why won't the Prime Minister call an election?
Well, there isn't an election due. The Prime Minister was very clear right from the start of the year that he expects a general election. The working assumption is that it'll be this autumn, and that hasn't changed.
Yeah, but why not? He doesn't have the support of the nation, it would appear, certainly if you look at the opinion polls.
Well, we have We have periodic general elections, and the Prime Minister has set out quite clearly an autumn time frame. And that there is, you don't call a general election just because there is a particular mood or a particular situation. That very, very rarely happens. Much better for the country and, of course, for the economic cycle, for the government's programme. The Prime Minister is absolutely focused on getting inflation down. We've just had £900 reduction in taxes for the average worker. We're seeing inflation yesterday dropping to 3.4%, so prices are rising much more slowly. We are focused on the Rwanda bill, trying to stop the small boats.
Says there's nothing to do with him when inflation goes up, and yet he's claiming responsibility when it comes down.
He's not claiming responsibility. What he's saying is that the government is focused on getting inflation down, and that is true. With economic policies, with all of the work that's going on to improve the environment for economic growth, it is the case that the government is seeking to reduce inflation, and that is successful. And the UK economy is now, we're seeing real wage increases at the same time as inflation's coming down. So although prices are still going up, it's much more slowly, and people are getting real wage rises, which is good news for people in their pockets. It gives them much more security, and the government is getting on with its programme.
Is it not that you need to have those planes take off to go to Rwanda in order to get a bounce in the polls?
It's that the government is getting on with its programme, and of course a part of that is stopping the small boats. It's one of the Prime Minister's key priorities, and actually I find it extraordinary that Labour in the Lords last night should seek to effectively repeat the amendments that we have just defeated in the Commons simply as a delaying tactic. And Keir Starmer knows full well that those small boats, they are being run by people traffickers at huge expense and at huge risk of loss of life and limb. And then they are coming to this country creating an enormous pressure on public services and on the public purse. So it's absolutely vital that we get those those flights taking off to Rwanda in order to act as a deterrent to people who are looking to take that perilous journey. That's what the people of this country want. They do not want to see illegal migrants pouring in here. And if we do nothing, which is what Labour would have us do, they do not have a plan, then we would simply see that increasing exponentially over this summer.
Thought finally on Theresa May leaving?
I mean, I am huge respect for Theresa May. I think she is an incredibly honourable and hard-working Member of Parliament.
She cost you being Prime Minister.
No, it wasn't like that at all, Kay. It really wasn't. I've told the actual truth of this so many times, but if you want to think that's fine, I have the greatest regard for Theresa May. I think she has done a fantastic job in her time in Parliament, and I wish her a very happy retirement.
Are you staying?
I am.
It's good to see you. Thanks very much indeed for
Thanks,
joining us.
Kay.
Thank you.